everyone, and welcome to today's lesson on critical incident management in the emergency department. So bad things happen, guys. In the emergency department, really, really bad things happen. Things that would make normal people run out screaming, but we don't. And that's because we're prepared. We know how to respond, and we take care of each other. So what is a critical incident? Well, we've all seen them on the news, or we may have been involved in one. Any unplanned or imminent event, and I'm going to give some examples. So the event's usually a threat to the health, safety, and welfare of not only us, but to our patients and the community. Critical incident, it requires a significant and coordinated response. This isn't just a case where you're going to page your attending. It's usually a large-scale mobilization of people and resources. Unfortunately, in a true critical incident, there's the chance that the resources can be overwhelmed. And basically, that means we can, simply run out of something like 4x4 gauze, or it can be something as serious as not having an OR to perform a life-saving operation. So when we talk about critical incidents, there are a lot of things that fall into the category. Natural disasters like fires, floods, earthquakes, hurricanes, tornadoes. And by the way, we talked about unplanned or imminent events. Well, a tornado or an earthquake would be considered unplanned, right? But a hurricane is usually an imminent event, something that we can expect to come a couple of days out. You also have unnatural acts, or is it non-natural? I don't know. Neither of those sound right. How about man-made disasters? Yeah, that sounds better. Anyway, things like active shooters, bomb threats, ED overcrowding, violence, all these can reach the level of a critical incident and tax your resources. So the first thing we have to do is prepare. And we do this with training. Classroom sessions, reading signs, sheets, that all falls under the didactic. These are just a few ways to disseminate the information to the nurses. And once the information is out there, we're going to conduct some small simulations. Individual departments, small groups, basically running through the flow of a critical incident. Now, once we've trained our team, we can get involved in large-scale disaster drills. Usually these involve entire departments, nurses, doctors, ancillary, lab, radiology, everybody. They also include the community. Now, this can be fire departments, EMS, police, the Office of Emergency Management. I myself have been involved in several of these type of exercises, and they can get pretty big. The last one I did was on a university campus, and the undergrad nursing students, there were about 120 of them, served as victims of the disaster, full moulage. And if you don't know what moulage is, that's basically makeup to simulate like wounds and burns and stuff. So they were all made up with their injuries. We had about 17 fire and EMS agencies taking victims from the scene to the ED where the drill continued. And through this, we were able to discover a number of areas for improvement, which brings us to the trial and error concept. Until you actually run through your critical incident protocol, it's hard to know where the errors are going to occur. I'll tell you, the best solutions are created when we make mistakes. So what do we do in a critical incident? Well, the first thing is you got to know your chain of command. Who's in charge? Now, this may be different from the normal day-to-day. Usually we report to an assistant nurse manager or nurse manager, then maybe the director. During a critical event, this may change, as there's usually going to be an incident commander running the show, and then section chiefs who we will respond to. It's important that you make sure you know who's running the show and who you need to speak to. Now, we all have to remember the basics. All hell is breaking loose, and stress levels are high all over. We want to make sure we're protecting ourselves first. We are number one. In a hazmat event, you may want to rush in and help, but if we contaminate ourselves, aside from creating more work by putting yourself on the shelf turbo deconned, we actually risk getting seriously injured. In a critical incident, we typically bring out the START triage process, which you guys can all learn about in our triage lesson here on nrsng.com. Go check it out. And of course, we need to work together. Aside from collaborating with all the parts of our department, we're going to need to collaborate with the entire hospital as well as the community at large. So after the threat is gone and the event is over, there's a period of time when that stress level is still really high. We can find ourselves looking back over the experience and sometimes reliving the worst parts. Now, this can take a real toll on our mental state, guys. It's recommended that everyone involved go through a critical incident stress debriefing. Now, this is a seven-phase process that occurs usually 24 to 72 hours after the event's done. Small groups of the team get together and discuss the actual event. And they go through 7 phases of induction, facts, thoughts, reactions, symptoms, teaching, and reentry. The goal of this whole process is really to reduce the pain or the emotional trauma of the incident and to facilitate kind of normal recovery of people who are normally psychologically healthy but have been affected by this unusually disturbing event. And it also helps to identify anyone who might need further support or some more professional care. In a critical incident, we have to communicate. The team only functions if each member knows what the others are doing. We need to remember prioritization as always. We are the most important asset in this event, guys, but then we need to do the most good for the most people. And above all else, we always have to stay safe. So a few key points. We need to know what a critical incident is. Anything that can stress our resources and cause increased stress can be considered critical. We need to train. The only way to respond well is to be ready for whatever may come. You need to know your chain of command during these events, as it can change from the normal day-to-day. Always protect yourself first, then protect your patients. And make sure you participate in the debriefing after the incident. If not for yourself, guys, then for your coworkers. Once again, guys, thanks so much for joining us for this lesson. Make sure to check out the rest of the emergency medicine series here at nrsng.com. And as always, happy nursing.